Hello, good day, and welcome to Newer TV. This is Dr. Zolom Mobani again, coming to you with Africa Scrolls. Today we'll be discussing postmenopausal bleeding. As a urogynecologist, I deal with this almost on a daily basis amongst my patients here at Nowhere World. Postmenopausal bleeding is any vaginal blood seen after a woman has completed 12 months of no period and has hence officially entered into menopause. If you see any perineal blood after your first 12 months of no menstrual flow and you're in menopause, you would need to come in to be evaluated. This is called postmenopausal bleeding, and it's our job to figure out what is causing it and fix it. Now, in the perineum of the female, like I always say, there are 3 holes. The number 1 hole, which is the urethral orifice. The number 2 hole, which is the anal orifice, the vaginal opening. Now, any of these 3 holes could ail and blood could come from them. Most of the time, you as the female is able to identify within some clarity where the blood is coming from. You are able to see if it's coming from your urethral orifice or mixed with your urine only, and otherwise you're dry. You may be able to see if it's coming from your anal verge or comes after a hard constipative stool, otherwise you're dry. Or you may notice that it's actually coming in like a period, whether heavy or spotty. Whichever one it is, we regard to it as abnormal vaginal bleeding in the postmenopausal woman, and it needs to be evaluated because most of the time they are not normal or within normal expectations. Your bleeding, if it's coming from the urethral orifice, may be related to a UTI in the urethra or in the bladder itself, or in the extreme end of the spectrum to a malignant or neoplastic or cancer process in these organs as well. So they also need to be checked out if I decipher that the blood is actually coming from your urinary system. In that regards, we will do a cystoscopy for you together with urinalysis and a cytology for malignant cells and a fish test of your urine. This is called microscopic or macroscopic hematuria. The commonest cause in the female in that regards is actually dryness of the urethra, causing urethral prolapse or urethral mucosal prolapse and irritation while sitting down. This is easily recognized during a vaginal examination on your visit. And then I will let you know that we'll do some extra urine tests on your urine, as well as schedule you for a cystoscopy where we would want to look in and make sure nothing is wrong with the rest of the tract. And then I'll treat you accordingly, either by replacing a vaginal estrogen cream or taking away the caruncle if so indicated. Now, if it's coming from your rectum, you may well have internal hemorrhoids with or without the external hemorrhoidal tax. And you may notice that it comes after a period of constipation and a hard stool being passed. That usually goes away and is of no consequence as long as it's only intermittent in nature, and usually presents as bright red blood that follows the stool or coats the stool on the outside. If that happens, then we'll treat you for constipation with diet and maybe supplements and treatments. And also we can give you things like hydrocortisone acetate suppositories to help shrink the hemorrhoidal vessels in your internal hemorrhoids. But I'm more interested in the vagina. If your blood is coming from the vagina as a postmenopausal woman, the most important question I'll ask you is whether you've been hysterectomized or not. That means whether there is an in situ uterus in or if the uterus has been taken out. But let's talk about what could cause it. The gamut of problems that could cause postmenopausal blood in a woman vaginally is vaginal irritation from extreme atrophy. That could happen anytime on its own or post-sex. But that is a diagnosis of exclusion if I don't see an obvious area bleeding during examination. And also if you have a uterus. If you have a uterus, then it behoves me to make sure that the blood is not uterine in origin. That could easily be seen from examination if I see blood coming from the external cervical os during a speculum vaginal exam. And if that happens, then we will take it a notch further. If I consider that you have a uterus and you're having blood that is thought to be virginal at all, generally you will get a pelvic ultrasound for us to assess your lining, which is the endometrium of the uterus. That is the part of your uterus that bleeds. That is the part that actually feeds the baby when you were menstrual. We can easily see if this lining is thickened. In the postmenopausal woman, is expected to be less than 4 millimeter in thickness most of the time. If it's more than that, it may be caused by a polyp, or it may be caused by hyperplasia, which is overgrowth, that may or may not show atypicality, that may or may not be a precursor to cancer. It could also be frank cancer. So should we see a thickened endometrium or even a non-thickened one, but we are sure that bleeding is coming from the endometrium, which is the inside lining of the uterus, we will schedule you for a hysteroscopy. That hysteroscopy will be mostly diagnostic, but can also be therapeutic or treatment geared. Hysteroscopy means that we're going to look into your endometrium with the help of a hysteroscope. We will scope it, see it in real life. Then we can see whether you have a polyp. If we do, we take it out. If it's thickened, we will see it and scrape it down and take samples to send to pathology for the final diagnosis. Now, when we see it and it's thickened and we don't think it's cancer, we can scrape you down such that that procedure in itself also becomes curative. And whatever we bring out of your body, we will send to pathology to give us the final diagnosis and to ensure that there is no malignancy in place. If there is malignancy, which is cancer, I will discuss with you what we found and lay down the plan on how we will go forwards with managing you. Endometrial cancer, by and large, when caught early, is purely curable, even with just surgery alone, and no other adjuvant therapy may be needed. But whatever is needed, we will make sure we'll get it done, and with a good treatment, both of us will go through it together and give you back your life. So should you see blood at any point in time as a postmenopausal woman, perineally, it behoves you to call us right away. We'll bring you in immediately, evaluate you, and do the needful. So that is the end of my talk on postmenopausal bleeding, and I'll see you at my next crawl. Thanks, and bye-bye.